Hello everyone, welcome to my channel. Today I'm going to speak about brain damage in memories. There are several different ways where certain terms and conditions that represent brain damage in memory. One such term is called as amnesia. Amnesia can happen ranging from brain damage or head injuries to problems arising through aging. It is also difficult to be sure that a problem really in some form of amnesia. It has been showed that most people have failures of memory in normal life, so it is very important not to confuse normal forgetting with a memory disorder. The usual standard is to assess whether concentrated effort consistently fails to succeed in tasks which most people find relatively easy. Basically, amnesia is a psychological condition in which memory is disturbed. It refers to any pathological loss in ability to acquire or recall information. The various causes of amnesia can be organic or functional in nature. Organic causes include damage to brain through trauma or disease or through the use of certain drug, whereas functional causes are psychological factors such as defense mechanisms. Historical post-traumatic amnesia is a basic example of this. Amnesia also may be spontaneous in nature, like transient global amnesia, etc. This type of amnesia is more common to middle-aged to elderly people. Particularly, it is more prevalent in males and lasts less than 24 hours. Basically, there are two types of amnesia: anti-retrograde amnesia and retrograde amnesia. Anti-retrograde amnesia is a form of amnesia where new events are not transformed to long-term memory, so the sufferer will not be able to remember anything that occurred after the onset of this type of amnesia for more than a brief period following the event. It is the basic disorder of encoding information. Different symptoms of anti-retrograde amnesia include: an individual with anti-retrograde amnesia will generally have good memory of the past until the time of brain injury, but will have extreme difficulty remembering anything that has happened since then. However, the person's personality, intelligence and judgment may be unaffected. Anti-retrograde amnesia, therefore, a selective memory deficit resulting from memory deficit in which the individual is severely impaired in learning new information. Memory for the first of events that occur before the injury may be largely impaired, but events that occur since the injury may lost out. This implies that with amnesia would have memory for childhood but for years before the injury, but may remember a little or nothing from the year since. STM is generally spanned, which implies that the individual may be able to carry on a conversation, but as soon as he gets distracted, the memory of the conversation fades. Most cases of anti-retrograde amnesia, patients lose declarative memory. Basically, it includes the semantic and the episodic memory of the recollection of the facts, but they retain non-declarative memory, often called as procedural memory. For instance, they are able to remember in same cases how to do things such as taking in phone, but may not remember what they had eaten earlier on that day for lunch. Different causes of amnesia include: anti-retrograde amnesia may occur following damage to at least three distinct brain areas. The first and most well studied is the hippocampus. It is the part of the limbic system. All emotions have their seat in the limbic system that is found in the midbrain and is associated area in the medial temporal lobes. Hippocampus seems to act as a gateway through which new information must pass before being permanently stored in memory. If it is damaged, no new information can enter memory, although the older information which has already passed through the gateway may be safe. Damage to the hippocampus can cause a stroke, a following stroke of aneurysm to one of the arteries which supply blood to these areas. Diseases like epilepsy, encephalitis, and hypoxia situations like carbon monoxide poisoning can also result in damage of the hippocampus and therefore produce anterogate amnesia. Alzheimer's disease, as it is causes damage to brain, can also result in anterogate amnesia. Anterogate amnesia can also occur following damage to basal forebrain, a group of stress which produces acetylcholine, a chemical that helps brain to store new information during learning. Anterogate amnesia can also occur following damage to diencephalon, a set of streets deep in the brain including the medial thalamic nuclei. Diencephalon include thalamus found in the hindbrain. Currently, there is no good understanding why damage to these brain areas should sometimes result in a selective memory deficit, such as amnesia. It is another major syndrome which is known as Korsakoff syndrome, a disease. It can damage the diencephalon, which can cause anterogate amnesia. Causes of amnesia that includes patients with epilepsy, brain surgery which they have undergone. The emphasis was on the temporal lobe. Some part of the temporal lobe and the hippocampus suffered the damage. Long-term memory and STM memory was found to be normal. Intelligence was also found to be normal. It was observed that the persons who would not transfer information from the short-term memory to the long-term memory, that is, he suffered from anterograde amnesia. He could not transfer newly learned information from the short-term memory to the long-term memory, because those fibers which transfer information from the short-term memory to the long-term memory suffered damage from the operations. He survived with old memory. He cannot recreate new information. Other case studies, it has been found that severe impairment of episodic memory occur in anterograde amnesia, where semantic memory remains relatively infected. This information was, in fact, after study of the patients, after administering the battery of neuropsychological tests, it has been found out that performed well in this test of visual naming and sentence comprehension and general semantic knowledge about the world. But the patient's episodic memory was far below the level of expectations. It must, however, be said that episodic versus semantic memory issue remain controversial and remain mixed research opinion. Research has also shown that anterograde amnesia for episodic memory due to storage problem. People suffering from amnesia or has a storage problem which present episodic information being established in the long-term memory. Along with this amnesia, we have another kinds of amnesia which is also called as the post-traumatic amnesia. Post-traumatic amnesia is the kind of amnesia which follows a severe blow or wound to the head. This can often result in the loss of memory for the few minutes leading up to the accidents. Recovering from post-traumatic amnesia goes through a regular sequence, beginning with confusion about location and about the accident. Occasionally, people may even substitute a previous accident from sometimes in the post-thinking. That is what just happened to them. Often at first, the person can't recall particular events and people from the first, but gradually this memory returns, and usually the most distant memories return before the recent ones. Korsakoff syndrome. Korsakoff syndrome is one of the most common sources of anterograde amnesia. It develops in long-term alcoholics who have been drinking heavily and not eating well for many years. This produces a thiamine deficiency, which eventually results in the person becoming unable to store new memories. People with Korsakoff syndrome often become highly skilled at maintaining conversation by making general remarks, so it is often difficult to realize how badly their memory is damaged. But sometimes it is so severe that the person can't recall someone they have made only that morning, if they meet them later in the same day or so. Typically, people with Korsakoff syndrome don't show any impairment to short-term memory or to basic skills like speech or driving, and often they are quite unaware that they have a problem. Those who do recognize it describes the experience as being like living in a dream with no sense of continuity or ability to make plans for the future. In some cases, too, Korsakoff's syndrome can produce retrograde amnesia, in which the person can't remember things that happened before the damage. Retrograde amnesia. Retrograde amnesia is the inability to recall information acquired prior to the onset of a particular disorder. It is a disorder of retrieval of information. Causes of retrograde amnesia. Retrograde amnesia can be both permanent and temporary in nature. Exemplary retrograde amnesia develops when a person experiences head trauma. Another form of temporary retrograde amnesia occurs when the patient undergoes electroconvulsive shock therapy or suffers a head trauma. In some cases, memory acquired over the previous weeks or months become unavailable. Amnesia can also be permanent. Some causes of permanent amnesia include prolonged use of electroconvulsive, severe trauma strike or other cerebral vascular ruptures, or due to the disease like encephalitis. Retrograde amnesia can also be brought by the massive consumption of alcohol. Kanshop syndrome, which result of chronic alcoholism, can result in permanent retrograde amnesia. The resource of retrograde amnesia has received many levels of attention than normal amnesia. Whatever research occurs suggests that episodic memories are rarely constantly impaired than semantic memories in case of retrograde amnesia. The extent of retrograde amnesia varies from patient to patient, involving severe retrieval problem for the memory informed several years before the onset of the amnesia. This is therefore, however, a possibility that in some patients or that occurs a minor retrieval problem. In retrograde amnesia, there is generally a temporal gradient, with retrieved problem being greater for the memory acquired closer on the onset of amnesia than those acquired long ago. The fact that retrograde amnesia is typically greater for the information acquired immediately preceding the onset of amnesia than from the information acquired earlier is of great theoretical importance. The establishment of long-lasting memory depends upon the physiological process of consolidation, and the disruption of consolidation can cause retrograde amnesia. Studies of patients indicates that the temporal gradient of retrograde amnesia is most often observed when the brain damage involves hippocampal region. It has been found the important role of hippocampus in the study of 4 patients with retrograde amnesia. Most amnesic patients show the evidence of both retrograde amnesia and anterograde amnesia, which might suggest that both the amnesia relates to the damage to same brain structure. Both forms of amnesia share features such as impaired recall impairments, recognition of factual informations, and impairment in autobiographical information. In spite of the implication of same brain area, this is also evidence that suggests that in the causation of these two amnesia, 2 different fields of the same hippocampus region may be involved.